Namaste, I, JVN, Anamika Verma, Associate Professor, Faculty of Pharmaceutical Sciences, Jyoti Vidyapeeth, Women's University. Today we will discuss about posology. Now, what is the meaning of posology? Posology is a combination of two words, that is how much and science. Posos means how much and logos means science. And definition of the posology is a branch of medical science which deals with dose or quantity of drugs which can be administered to a patient to get the desired pharmacological actions. It is responsibility of the prescriber regarding the amount of the drug to be prescribed on the frequency at which the drug to be administered. What are different factors influencing dose? The optimum dose of a drug which produces the desired therapeutic effect may vary from person to person. The factors which influence the dose of the drug are as age, gender, body weight, route of administration, time of administration, environmental factors, emotional factor, presence of disease, accumulation, additive effect, accumulation, additive effect, idiosyncrasy, tolerance, tachyphylaxis, and metabolic disturbances. First, we will discuss on age. Age affects the pharmacokinetics of many drugs changes with age. While determining the dose of a drug, the age of an individual is of great significance. Children and old people need lesser amount of drug than the normal adult dose because they are unable to excrete drugs as compared to adults. Gender. Care should be taken when drugs are administered to female patients, especially during menstruation, pregnancy, and lactation. Example, strong purgatives such as aloes should be avoided during menstruation. Drug which may stimulate the uterine smooth muscle. Example, drastic purgative anti-malarial drugs and ergot alkaloids and contraindicated during pregnancy. Certain drugs which on administration to the mother are capable of crossing the placenta and affecting the fetus. Example, alcohol, barbiturates, narcotic, and non-narcotic analgesics, etc. During lactation, the drugs like antihistamines, morphine, and tetracycline, which are excreted in milk, should be avoided. Third is the body weight. The average body dose is measured either in terms of mg per kg body weight or as total single dose for an adult weighing 70 kg. It should be calculated according to body weight in case of obese patient, children, and malnourished patient. Route of administration. Intravenous dose of drugs are usually smaller than the oral dose. The onset of drug action is quick with intravenous route, and this may enhance the chances of drug toxicity. Time of administration. The drugs are mostly rapidly absorbed from the empty stomach as the presence of food in the stomach delays the absorption of drugs. The amount of drug which is very effective when taken before as a meal may not be that much effective when taken during the after meals. The irritating drugs are better tolerated if administered after meals. Example, iron, arsenic, and cod liver oil. Environmental factors. Daylight is a stimulant, enhancing the effect of stimulating drugs. Daylight is diminishing the effect of hypnotics, and darkness is sedatives. The amount of barbiturate required to produce sleep during daytime is much higher than the dose required to produce sleep at night. Alcohol is much better tolerated in cold environment than in summer. Emotional factors. Females are more emotional than males and requires less dose of certain drugs. Inert doses forms called placebos, which resemble the actual medicament in the physical properties, are known to produce therapeutic benefit in diseases like angina pectoris and bronchial asthma. This personality and behavior of a physician may influence the effect of drugs, especially the drugs which are intended for use in psychosomatic disorder. Presence of disease. During fever, a patient can tolerate high dose of antipyretic than a normal person. Example, streptomycin is excreted mainly by the kidney may prove toxic if the kidney of the patient is not working properly. accumulation. The cumulative effects are usually produced by slow excretion, degradation, and rapid absorption of drugs. Repeated administration for a long time produces high concentration in the body and toxic symptoms. Example, digitalis, imatin, and heavy metals. Sometimes a cumulative effect is desired in drugs like phenobarbital in the treatment of epilepsy. Now, additive effects. When the total pharmacological action of two or more drugs administered together is equivalent to sum of their individual pharmacological action is known as additive effect. For example, combination of ephedrine and amylophyllin in the treatment of bronchial asthma. Synergism. When two or more drugs are used in the combination form, their action is increased. The phenomena is known as synergism. Synergism is very useful when desired therapeutic result needed is difficult to achieve with a single drug. Example, procaine or adrenaline combination increases the duration of action of procaine. Antagonism. Antagonism is defined when the action of one drug is opposed by the other drug on the same physiological system is known as drug antagonism. The use of antagonistic responses to drug is valuable in the treatment of poisoning. Example, milk of magnesia is given in acid poisoning. Idiosyncrasy. An extraordinary response to a drug which is different from its characteristics pharmacological action is called idiosyncrasy or drug allergy. For example, small quantity of aspirin may cause gastric hemorrhage, or some persons are sensitive to penicillin and sulfonamide because they produce severe toxic symptoms. Tolerance. Drug tolerance is required for a large dose of drug is to evoke an effect produced by the normal therapeutic dose of the same drug. Example, smokers can tolerate nicotine. Alcohol can tolerate large quantity of alcohol. Tachyphylaxis. When certain drugs are administered repeatedly at short intervals, the cell receptors get blocked up and pharmacological response to that particular drug is decreased. Then the decreased response cannot be reversed by increasing the dose. This phenomenon is known as tachyphylaxis or acute tolerance. For example, ephedrine, when given in repeated doses at short intervals in the treatment of bronchial asthma, may produce very less response due to tachyphylaxis. Similarly, drugs like amphetamine, cocaine, and nitrates behave in this way. Metabolic disturbances. The effect of drugs may be calculated by the changes in water electrolyte balance, acid-base balance, body water, and other physiological factors. Example, salicylates reduce body temperature only in case an individual has rise in the body temperature. They have no antipyretic effect if the body temperature is normal. The absorption of iron from GIT is maximum if the individual has iron deficiency anemia. Calculation of dose. Stage Young formula. Response of drug may and surface area. Infants are required. Laser dose standard vary from one patient to another. The dose for children can be calculated from the adult dose by using age, body weight, etc. Depending upon the age, young formula is calculated as child's dose, or dose for child. Age is equals to age in years upon age in years plus 12 into adult dose. Dilling's formula. dose for child or child dose, age in years upon 20 in adult dose. 4 to 20 years of age is counted in children's age. Clark's formula, dose for the child or child's dose is equal to child's weight in kg upon 70 or weight in pounds upon 150, that it would be in double quantity, into adult dose. The adult dose of paracetamol is 500 mg. Next is based on the surface area, child dose equals to body surface area of child upon body surface area of an adult into adult dose. Thank you.